I have been fixing equipment in hospitals for 22 years. Before that, I spent 6 years as a Navy corpsman, so I know what good care looks like, and I know what a room smells like when it is about to go wrong. I have pushed a cart through every floor of Harwick Memorial, tightened the same bolt on the same IV stand on the fifth floor surgical ward more times than I can count, and in all that time I have made a point of not getting involved in staff politics. When you are the man who fixes the machines, opinion is expensive and silence is free. I am telling you this so you understand where I stood when Dr. Clifton Pruitt made his announcement. Pruitt had been chief of surgery for 11 days. He came from another hospital system with a reputation for efficiency, which at Harwick seemed to mean that he walked the floors fast and looked at the nursing staff the way a man looks at furniture he is deciding whether to keep. I was at the supply room junction when he gathered the morning staff near the nurses' station. I was checking a portable monitor. I was not meant to hear, but the corridor is long and voices carry. He said that going forward, direct patient management on surgical recovery would be restructured. A nurse of generalist background, he did not use her name, but every person there knew who he meant, would be transitioned to a support role effective immediately. Restocking supply carts, transporting lab specimens, logistics coordination. He said, and I remember this exactly, that the floor's level of care required either a physician or someone with a more specialized clinical background, and that running a floor on sentiment was a luxury a serious surgical unit could not afford. Peg Sorrell was 4 feet from him when he said it. She was 58, compact and straight-backed, with close-cut gray hair and hands that had been washed so many times they looked older than she was. She held a chart against her chest throughout. She did not look at him while he spoke. She looked at a fixed point in the middle distance, the way a person looks when they are deciding what to keep and what to let go. When he finished, she set the chart on the desk, said, "Understood," and went to get the clipboard. I told myself, pushing my cart to the elevator, that he probably had a point. I had always thought of Peg as solid, quiet, serious, the one who caught things others missed, but I had no credentials to evaluate clinical competence, and I knew it. I told myself this was hospital business, and I was the man who fixed the machines. The alarm came from room 514 at 4:17 that afternoon. The patient was a 44-year-old man, post-operative from a routine arthroscopic knee procedure, admitted that morning walking on his own. What no one had flagged, because his intake had been quick and his record processed in a hurry, was a prior fragment wound to the chest wall that had left scar tissues around the pericardium. He was presenting with falling blood pressure, distended neck veins, and a building agitation that a less experienced eye would read as post-anesthetic anxiety. Dr. Oakes, the attending, was calling for a sedative when Peg came through the door pushing her supply cart. Peg stopped in the doorway. She looked at the man on the bed for 4 seconds. Then she set the cart against the wall and said, in a voice that was not loud but left no room for argument, "Hold that order." Oakes turned. "Excuse me?" "His neck veins," Peg said. "His pressure has been dropping for 20 minutes, and his heart sounds are distant. I need someone to check his chest history before we sedate him." Oakes reminded her she was on supply rotation and had no patient assignment. "I know," Peg said. "I'm telling you what I'm seeing." A resident pulled the chart and found the old fragment wound notation. Another one went pale. Oakes looked at the chart, then at the monitor, and her certainty began to loosen. Cardiac tamponade. Fluid compressing the heart inside its sac, cutting off the fill, dropping the pressure toward a floor the body cannot sustain. It presents atypically often enough to fool experienced clinicians. The protocol Oakes had been moving toward by reflex would have sedated a deteriorating man and bought him perhaps 20 minutes before the picture became irreversible. The echo machine was 4 floors down and locked behind a scheduling queue. Peg looked at the younger resident, a second-year named Castillo, frightened but not frozen, and walked him through a needle pericardiocentesis, using supplies from the ward cart. Her voice stayed level throughout, as if she were describing something routine. She told him where to angle, when to stop, what he would feel when the needle found the right space. Once, when he hesitated, she said simply, "You have him. Keep going." The fluid they drew off was exactly consistent with what she had described. The echo arrived 40 minutes later and confirmed her diagnosis. The patient's pressure stabilized. His heart rate came down. He was asking for water before the orderly rolled the cart back out. I had been standing in the hallway the entire time. I had not moved because I could not make myself move. I am a former corpsman. I know what I was watching. It was not luck, and it was not instinct. It was pattern recognition built from a kind of experience that does not come from a surgical recovery floor. And when I understood that, I understood I had been wrong about Peg Sorrell. in a way that said something about me. The 9 men came off the elevator at 8:40 the next morning. They were in army dress uniforms, all of them, moving down the corridor with the particular stillness of men who have done difficult things and feel no need to announce it. The one in front was a sergeant major, broad, gray at the temples, with a chest rack of ribbons that most people in that hallway could not have, named. 8 more followed. Dr. Pruitt was making his morning rounds at the far end of the corridor. He stopped and did not seem to know what to do with his hands. The sergeant major found Peg at the supply station, logging a restock inventory. He said her name, the way you say the name of someone whose name means something to you. He said that the patient in room 514 had called him the night before, first time he'd heard that man's voice in 3 years, and that the patient had told him there was a woman on the 5th floor who had saved his life a second time. He did not read from anything. He spoke from memory. The operation, the valley, the 9 hours, the 14 men who came out of it, when the mathematics of that firefight said they should not have. He named Peg's rank and her designation and the actions for which she had been cited, in enough detail that it was plain he had been there. He said she had worked through the night without resupply, making calls under conditions that would have tested most surgeons, and that every man she had worked on had lived. Then he reached into his breast pocket and placed a pound coin in her palm. Behind him, one by one, the 8 other soldiers did the same, until she held 9 of them. From room 15, audible because the door was open, came the sound of a bed shifting. Specialist Garrett appeared in the doorway, in a hospital gown, on a knee 2 days out of surgery. The charge nurse said his name. He paid her no attention. He came to the threshold, drew himself upright, and rendered a salute that was slow and deliberate and held until it had said everything it needed to say. Peg stood straight. She held the 9 coins in both hands. She did not cry, and she did not perform. She gave one small nod, the way a person nods when an account has been settled and no more needs to be said. Pruitt had not moved from the far end of the corridor. He did not speak. I am not a hard man, and I have no particular feeling about him now. He was simply someone who had the misfortune to call something worthless that 9 men in dress uniform had come, at their own choosing, to correct. I'm 57 years old. I have spent most of my life in hospitals, first in uniform, and then with the cart, and I have learned when to speak and when to keep still. But I will tell you what I know. Some people carry everything they are in a quiet way, and the only way you find out what that is worth is when the moment asks for it. Peg Cicerelle had been carrying it on this floor for 9 years, and we had looked right past her. I was there when the account was settled. I will not forget it.